Yeah, so I got interested in air pollution, and the perspective that I've taken is that from a hospital and healthcare system, as a pediatric anesthesiologist, and so I work at the Children's Hospital of Los Angeles. And in the last few years, what we've come to realize is that there are certain kids under anesthesia. While many of us think of anesthesiologists as those physicians that put kids and adults to sleep for the surgical procedures, in addition to that part, many times we are helping them breathe artificially, and there can be difficulties with breathing under anesthesia on the process of going to sleep and then waking up. In particular, are some of the most challenging times that we can face when we take care of kids asleep during anesthesia. And those breathing problems actually look very much like severe asthma attacks or exacerbations. And so one of the things I've noticed in the last few years, and I've had the privilege of working at different children's hospitals around the United States, was that some children actually have a bumpier ride with anesthesia. Their flight, for example, is a little more turbulent on takeoff and landing, going to sleep and waking up. And what I've started to notice was that those children had certain characteristics about them. Of course, some of them we know are exposed to cigarette smoking at home. And some of them might live in certain areas of the city. And so what I started looking at was their address of where they are located. And once I pulled up their address from the electronic medical record, you start to get a map in your mind about what the city looks like and where these children live. And it appeared to be that they live near highways. They live near more industrial zones. Maybe on a map, if you were to look at it, it appeared that they lived in areas that had less green space, for example. And that led me down the whole pathway of thinking about what are the other factors that could be contributing? What are the social determinants of health, actually, that could be contributing to children having difficulty with anesthesia and the intensive care units at our hospitals? And so that basically started all of it. And we're embarking on a whole project and development of how do we incorporate more data about air pollution and social determinant of health factors into our electronic medical records, and then provide that data to our physicians, not just in our hospital and health system, but potentially around the world, to better understand where their patients live, what are they exposed to, and how can we consider treating them for that.